My name is Alejandro Aponte, and welcome to my MSRPx 2020 presentation. There was once a student that dreamed about becoming an engineer to develop amazing inventions that could help others. Following that dream, he went to university to study mechanical engineering. And for the first couple of years, everything seemed to be going well. He was doing good in his classes and even joined a couple of extracurricular projects to gain more experience outside the classroom. Suddenly, about halfway through his degree, he started having problems with his classes. Concentrating became even harder for even the most simple and common things, and his days were filled with headaches and sudden humor changes. As he searched for an answer, he got diagnosed with ADHD and depression. And at the moment, in order to push through his academic responsibilities, the best solution available was just daily medication. That student, it's me, and that's my story. And just like me, there are millions of people around the world that suffer from some type of neurological disease and are trying to find a solution. As we move forward in the world of neuroscience, the need for more efficient biomedical methods increases, particularly methods that can allow us for less invasive research and treatment processes, especially when working directly with the brain. In order to have a better understanding of brain disorders, a potential method can be the use of brain interstitial fluid to monitor and analyze neurochemical dysregulation. Sadly, the technology needed to advance this methodology is still lacking, not that accessible, and has many areas of high risk. One of the top used methods to sample interstitial brain fluid is microdialysis, using a semi-permeable membrane that is inserted into the brain. This technique can be used to access prevalent neurochemicals from interstitial fluid. Nonetheless, because of its dependency on the semi-permeable membrane, this method still has a series of challenges. Large probe size can lead to brain tissue damage. This also limits access to some areas of the brain and makes the process incompatible with longitudinal studies. On the other hand, the semi-permeable membrane is limited to smaller sized particles. This limits the access to larger particles like neuropeptides, proteins, and dense extracellular vesicles. And if the probe is enhanced in size, it can lead to leakage of perfusion fluid and reduces spatial resolution. All of these challenges show that a more capable and less invasive research tool is needed. This is where Professor Sima's research team comes in. This summer, as part of the MSRPx program, I was fortunate to join his team at the Koch Institute for Integrative Cancer Research. Currently, the team is developing a micro-invasive sampling platform composed of a nanofluidic peristaltic pump and a membrane-free probe smaller than currently used probes. As part of my research experience, I joined the team in charge of developing the nanofluidic pump under the leadership of Dr. Richard Rahman. The goal is to create an implantable peristaltic pump capable of bidirectional flow by using electrically stimulated nickel titanium wire, better known as NINO, as the compression actuators. The aim is to develop a design that can be used for longitudinal tests and targeted drug delivery. In addition to the bidirectional flow not found in other state-of-the-art low-flow pumps, our design eliminates the need for additional interfacing connectors, as required for traditional syringe pumps, drastically reducing pump depth volume. It also offers precise low-volume control. Our design has already been tested in vitro and in vivo with rodents as a portable device. If we compare our solution with the current state-of-the-art system, our design provides an advantage in 7 major key points. This results in a more efficient and safer solution. During my first time working with the team, the project was in its initial stages, and I was assigned with programming and testing different actuator patterns to generate different fluid displacement profiles. As part of my work, I also helped in optimizing the testing setup, starting with just simple video recording of the experiment, all the way to adding computer tracking with video analysis software, a microscope camera, and even LED indicators. With that last setup, we were able to characterize the fluid displacement profile and the nano activation time versus electric pulse. The first graph shows the displacement of the fluid over time, and the second graph shows the electric pulse and the time it took the nano to compress and decompress. Now, during my second time working with the team, we were focusing on the process of miniaturization to achieve an implantable design. As we go smaller, our initial goals are the following. Validate that the power consumption does not exceed current state-of-the-art energy storage solution, a hermetically sealed design, and that the fluid displacement control meets the requirements for a variety of studies. During this phase, I helped the team by providing CAD models and designs recommendations that could help us define the implantable finished product. I also helped with electrical analysis and power consumption calculations of the device. With that information, we then proceeded on comparing the different commercially available batteries in the market to identify a good fit. This also helps us define what is a smaller size that we could achieve based on battery limitations. From the broader impact perspective, in addition to developing a tool that would allow neuroscientists to surpass some of the challenges regarding microdialysis, it also means in the long run that we could have a better tool for diagnosis and treatment of patients with neurological diseases. From the economical perspective, in an article published by the American Neurological Association, presents that in 2014, the American economy suffered an impact of $719 billion due to this type of diseases and conditions in the American population. And from someone that understands the struggles and the challenges regarding this type of conditions, I know that this would not only mean a better tool for patient treatment, but it also means that patients with these type of conditions can achieve a happier and healthier lifestyle, achieving a balance in their life. Thank you for your time. This concludes my MSRPx 2020 presentation.